Staffing shortages are being felt by many hospitals across the province of Ontario, as well as some temporary closures at intensive care units. In many cases, have left nurses saying they feel burnt out. And joining me now for the latest on that is Claudette Holloway, who is the president of the Registered Nurses Association of Ontario. Thank you so much for making the time. Perhaps just before we get into things, just maybe give me a sense of what registered nurses across the province of Ontario are really feeling with some of these staffing shortages, and I guess to what extent has it actually had an impact on registered nurses, and how can the government work to address some of these staffing shortages?
Well, first of all, thank you so much for the opportunity, Wyatt, to discuss these issues. And what we're hearing from our members is that they're feeling absolutely undervalued. They are burnt out. They have little control over their work environment. They're not able to deliver the quality care that they need. It's causing them distress because they're not able to deliver that quality of care. So the situation is not only dire, but it is dangerous for the health of Ontarians. And it's leading to, we're well into a collapse of our healthcare system.
How important is it for the health minister to address the crisis in front of the public? And what value do you ultimately think, as the president of the Registered Nurses Association, what value do you think having the health minister address the crisis would bring?
It is absolutely valuable, and we look forward to working with the minister to inform her of the information that we already have. She doesn't have to go back and investigate. We have done the studies. We have got the information from those on the front line, and therefore we look forward to working with her. But basically, our asks are that if Bill 124 could be repealed, that would do a lot to encourage nurses back and to show them that they're valued and they're respected and they're being heard. Also, we know that we have a number of thousands of internationally educated nurses who are just waiting for the process to be integrated into our healthcare system. So we really want our minister to do all she can to expedite that. If it's resources that our College of Nurses need, we're asking her to expedite that.